Hello, this is Ruth Hollingshead, trustee for Site for Wight, welcoming you to this week's Talking News.
Site for Wight news for Friday the 24th of April 2020.
Isle of Wight County Press, Alison Holbrook. Isle of Wight Scouts to renew promise at home today, St George's Day. The coronavirus won't stop Island Scouts from renewing their promises on St George's Day today, with members sending in videos of themselves reciting their commitments. Every year, more than 1,000 scouting members on the Isle of Wight renew their promise at events and parades across the island on or around St George's Day. With face-to-face activity out of the question, this year Isle of Wight County Commissioner Dave Simpson has challenged everyone involved in island scouting to video themselves renewing their promise at home. The promise is the commitment made by all members as they join, vowing to share the values of scouting, said Dave. While the country is coping with coronavirus, I wanted to ensure that everyone has the opportunity to renew their promise. Videoing the renewal is an easy way for everyone to record and share their promise renewal. Scouting is continuing during the current restrictions, with meetings held through Zoom, FaceTime, WhatsApp and other video conferencing apps, as well as challenges such as the Promise Renewal and the National Scouting at Home initiative. Guidance has been issued to scouting across the island on how to undertake the Promise Renewal at home and how to share the video or photograph of the renewal. In the lead up to St George's Day, we will be posting some activities on our Facebook page, underlining the importance of the promise, said Dave. Former members of the Scout movement are also welcome to join in the promise renewal.
This is Brian reading an article from the Isle of Wight County Press. Terrific village character. 92-year-old Don plays accordion for his neighbours. Donald Trappett, 92, has been at the vanguard of the Clap for Carers campaign, playing songs on his accordion from his home in Bembridge. The Grange Gardens resident has been serenading his neighbours every Thursday evening and wants the whole nation to pick up instruments and strike a note for the key workers. It would be nice to have another nationwide campaign where we could all play and sing for the key workers, said Don. If we start something on the island, it might snowball. I'm playing from my garage. It's a bit warmer in there. At 8 p.m. we all clap, and then I play something suitable. You'll never walk alone. There'll always be in England. He's got the whole world in his hands. I play for half an hour, and then my hands get cold, and everyone starts disappearing. He's a terrific village character, said Zita Bishop, organiser of Your Chance to Shine, where locals come together to showcase their talents. He nursed his wife at home until she died. He's always so upbeat and positive. Absolutely amazing man. He's in his 90s and still wants to help. Don's daughter, Jane Croucher, who lives in Southwick, put out a request on Facebook for someone to film her father playing, and Don's neighbours were quick to answer the call. We all love Don. He's an amazing man, said Kate Gardner. It would be a pleasure.
This is Chris reading an article from the County Press. Permission granted. Community garden to become bin stores. Disappointment for residents in Freshwater, as the Isle of Wight Council has granted permission to put bins on a community garden. Plans have been approved for Southern Housing Group, SHG, to install 16 waste stores, which will house 64 bins in 4 locations around a part of Jubilee Close, Freshwater. In a planning statement, SHG said the current placement of the bins is unsightly and had been identified as an unacceptable fire risk, which had to be sorted immediately. It said, the design, location and setting have been developed to eliminate any adverse impact on the amenities of nearby residential users. Currently, part of the spaces are being used as a community garden, which will be concreted over to create a base for the bins. The green space was created after residents applied to SHG's Gardening Neighbours scheme, where funding was provided to transform the area, adding colours and various flowers. When residents became aware of plans to get rid of their garden, they launched a campaign to save it, with more than 200 people signing a petition and Freshwater Parish Council pledging its support. Read more. Isle of Wight residents dismayed at plans to replace community garden with bin store. The Parish Council objected to the application, saying residents and councillors should decide in consultation with SHG where the bin should go, and noting the design is not appropriate or suitable for people with disabilities. However, apart from the Parish Council, the Isle of Wight Council's planning team received no other objections to the application. Officers granted permission for the bin stores after visiting the site and noting a large number of bins are grouped together, which appears unsightly and cluttered. In an officer's note, they said the proposed bin stores would be sited in communal garden areas, appropriately distanced from the properties themselves. The application should result in an improved visual appearance compared to the existing situation, and officers considered there would be no greater harm caused to the amenities of the surrounding properties.
This is Howard reading an article from the Isle of Wight County Press about Ventnor Post Office. Ventnor locals now have a banking and postal facility in town thanks to a community effort to get Ventnor Post Office back open again. It opened its doors yesterday with a couple of customers at a time due to social distancing measures. It will be open from 10 a.m. to 2 p.m. on Mondays, Thursdays and Fridays. Ventnor Town Council volunteers will man the doors and local businesses help provide staff with PPE. The shop which houses the post office had been closed since lockdown, and this drew criticism from Isle of Wight councillor Gary Pearce, who said it was disgraceful of the owners not to find a way to remain open. Owner Andy Smith said of the opening, "It really shows what can be achieved with positive community action, which is what Ventnor is all about." A big shout out to those who've helped and support us to adapt, rather than criticise and abuse us for being temporarily closed. This is new for all of us. I've realised this virus isn't going away anytime soon. We all have to adapt to it, and we'll manage the risk to us, our staff and customers as best we can. We do both have health conditions that put us at risk, but we'll open and run the post office as safely as we can. We don't expect our two staff to do it though, so they'll stay safe at home.
This is Sue reading from the Isle of Wight County Press. Asda and Aldi introduced new no-touch rules for shoppers. Here's what it means. Asda and Aldi have urged shoppers not to touch products unless they intend to buy them. The rule is one of the latest measures being launched in supermarkets across the country to protect customers and staff with use of the government's social distancing guidelines. What is the guidance from Asda? Addressing the new changes brought into its stores, Asda has said it hopes such measures will prevent further spread of the virus. A message on its website reads, "These changes adhere to the advice from the government and have been put in place to keep you and our colleagues safe. We're asking customers to only touch items they intend to purchase and to use cashless payment whenever they can to minimise contact. There will also be clear signage, directional barriers and floor markings to help you move around our store easily and maintain a 2-metre distance from other customers and our colleagues. You are allowed to bring your children and other members of your household to our stores, but we ask that you keep this to a minimum to help us maintain social distancing advice. There will be regular announcements on Asda Radio to remind customers of their responsibility to apply social distancing rules, and to help you do this, we are closing every other self-checkout till. What is Aldi saying? Aldi has also urged its customers to only touch items they intend to buy or things they intend to use in store. A spokesperson for the supermarket chain said, "Sanitisation stations are in place at the front of stores, so it is easy for customers to disinfect their hands, trolleys and baskets before doing their shop. Our store colleagues may ask that customers only touch trolleys they intend to use." Other social distancing measures in place in UK stores. The new rule comes after the government extended the country's lockdown by an additional 3 weeks to be reassessed on May the 7th. The no-touch policy adds to the list of many new rules being implemented in supermarket stores across the UK. Other measures include limits on popular and essential items, encouraging contactless payments, limiting store visits to one person per household at a time, as well as dedicated store opening times for vulnerable customers and frontline workers. Some retailers, such as Asda, have launched volunteer shopping cards to help vulnerable customers who are self-isolating allow a dedicated volunteer to shop on their behalf without risk.
This is Howard reading an article from the Isle of Wight County Press on the conversion of a church into a house. The Isle of Wight Council has approved planning permission for this conversion. Submitted by the Isle of Wight Methodist Church Circuit, Bochum Methodist Church on Bochum Road will become a 4-bedroom affordable house. The church ceased services in June last year. The main alteration to the building internally will be a mezzanine level added, with the current church windows looking out across the valley, providing the main living space. A planning statement prepared for the application said, uppermost in the design concept was the desire to retain the existing building's original identity, one of a simple and unadorned place of worship built to serve the religious needs of the local farming community, while providing an attractive, functional, accessible and adaptable residential environment for the prospective occupants. It cannot be denied that working within constraints presented an architectural challenge. However, the church trustees are confident the design submitted has achieved the brief of retaining the existing character of the building and making best use of the available space. Permission was granted for the conversion and demolition of a toilet block earlier this month, but is subject to 11 conditions, including building a bat box for the pipistrelle bats who roost in the church and allowing archaeologists access at any time to record any features of archaeological significance found during the works, as it's close to the Clatterford Roman villa.
This is Chris reading an article from the County Press. An extremely rare 10th century coin found on the Isle of Wight made £9,000 when the hammer went down at auction today, Wednesday. The silver penny, which dates to the boy King Edward the Martyr, who ruled Saxon Britain, had a guide price of up to £7,000. Once buyer's premium is added, its new owner must pay £11,160. Auctioneers Dix, Noonan Webb are helping raise funds for the NHS Charities Together COVID-19 appeal. 5% of the coin's sale price will go to the fund. The penny was discovered in a ploughed field in March 2018 by a 68-year-old retired council worker using a Mine Lab ETRAC metal detector. The coin is said to be in a remarkable condition and features a fine portrait of the boy king wearing a diadem and facing left. The Isle of Wight County Press also reported it bears the phrase Edperd Rex Anglorex, Edward, King of the English. On the reverse, is a small cross patty in the centre and Ayleston Meo Cant, Ayleston Munier of Canterbury. Edward ruled between 975 and 978 AD and was only 13 years old when he was crowned king, after the death of his father Edgar. Edward was assassinated at the Saxon Hall, where Dorset's Corfe Castle now stands, by supporters of his brother Ethelred.
This article is from the Isle of Wight County Press, and I'm Stephen McDevitt. Coronavirus testing unit to open on the Isle of Wight. Testing on the island will ramp up this week as a mobile testing unit is set to open. The Isle of Wight Clinical Commissioning Group, the CCG, has announced today, that's Tuesday, that testing for hundreds of key workers will go ahead without them having to travel to the mainland. Alison Smith, Managing Director of the CCG, said, "We will have a mobile testing unit to come to the island and provide tests here. The plans are in their final stages, and we will be able to share more details with you once these are complete." This is welcome news and brings reassurance that testing will be taking place on the island to help protect our key workers and the rest of the island's population. We don't want people to have to cross the Solent to have their test, which is why we have been working on a model fit for the island. Our key workers have been providing an absolutely tremendous service, often going above and beyond what is asked of them, and we want to roll out the testing as soon as possible. Drive-through testing centres are being established across the country, with reports the closest to the island will be in Portsmouth. However, Island MP Bob Seeley said he had been in talks with the Isle of Wight Council to try and avoid travelling to the mainland for testing. He said, "As an island, we have unique circumstances when it comes to testing. I have raised this with the local government minister and public health minister, and I hope for news on this shortly." Earlier today, that's Tuesday, the leader of the Isle of Wight Council, Councillor Dave Stewart, said testing would come to the island, but that the last few details are being sorted out.
This is an article from OnTheWight, read by Terry. Isle of Wight beer and buses weekend cancelled due to unknowns of COVID-19 crisis. The Isle of Wight Bus Museum and CAMRA, that's the campaign for Real Ale, have announced that the classic buses, beer and walks weekend, due to be held on the 10th and 11th of October, has been cancelled. The coronavirus pandemic is having a profound effect in many areas of life, including adversely affecting the intensive planning for this hugely popular weekend event. Under normal circumstances, the Beer and Buses weekend takes several months to plan and coordinate. Even if the current lockdown is lifted in May, there are numerous concerns about the viability of the event. This includes uncertainty around requirements for social distancing in the autumn, or if large public events will even be feasible. Last year's event was the biggest yet, with some 18,000 visitors. Over 100 classic buses and coaches took part, along with 120 licensed venues. Ben Bartram, the principal organiser for the Isle of Wight Bus Museum, revealed that the decision was not an easy one to make. There are simply too many unknowns at present, too many factors that make forecasting even a few months ahead difficult. There are logistical issues around vehicle preparation, both those from the Isle of Wight Bus Museum and the large number of visiting vehicles. We also recognise that some vehicle owners may be suffering financial hardship because of the national lockdown. Another major factor is how long the current enforced closure of pubs and other licensed venues will last. Tim Marshall of CAMRA said, "We cannot assume that Pubs, clubs, hotels and other accommodation providers will be open at that time. Naturally, we wish all of them every success in reopening when it is possible to do so safely. CAMRA will be offering support wherever possible, so we hope that they will consider joining in with the event again in future. We certainly intend to be back next year.
This is Brian reading an article from OnTheWight. Police appeal for witnesses after second night of fire at car parks. Police are appealing for witnesses after a fire was set off at a National Trust car park on the Isle of Wight yesterday, 20th of April. Officers believe a fire was set to 2 hay bales at the entrance to Compton Farm at around 11 p.m. last night. Hampshire Fire and Rescue Service attended and extinguished the fire. Fire at Compton Bay car park. This comes after a number of hay bales were set alight at Compton Bay car park on Sunday night between 9 p.m. and 9:45 p.m. Officers investigating are keen to speak to anyone who might have information that could help us. Get in touch. Did you see anyone acting suspiciously in the area? Do you have any information that might assist in our investigation? Anyone with information can phone 101 quoting 44200139914. Alternatively, you can call Crime Stoppers anonymously on 0800555111.
This is Howard reading an article from the County Press on the possible early end to the lockdown on the Isle of Wight. It follows reports that the leader of the Isle of Wight Council, Dave Stewart, is planning an SOS, that's Save Our Summer campaign. Councillor Stewart has refuted any claims the island could see restrictions end early and said any exit needs a well-managed approach. In an article today, that's Wednesday, the Telegraph claims the island is among a handful of places requesting an early end to the COVID-19 lockdown due to an apparently low rate of coronavirus infection. According to the official numbers, the Isle of Wight's hospital cases are among the lowest in the country. However, the impact of the virus in care homes and the community is less clear, and widespread testing has yet to take place. A professor of bacterial science told the Telegraph that our official infection rates, combined with the ability to track visitors to islands like ours, means it's easier to trial a lockdown exit strategy. We're not guinea pigs, says the Isle of Wight Labour chair, who strongly opposes any early end to lockdown, given the island's high proportion of elderly residents in high-risk groups. Labour chair Julian Critchley said, "We've just had the army finish building new facilities. With temporary refrigerated containers at the cemetery. Island police are tweeting daily about issuing fines. It's very difficult to square those facts, let alone unofficial accounts of the virus spreading in our care homes. The only criteria for assessing whether the island's lockdown should end is whether it's safe to do so." Echoing Labour's fear that the islanders would become guinea pigs for the new policies, the Green Party is calling for greater access to testing for Isle of Wight key workers, vulnerable people and those with symptoms. It's called the idea of an early exit insensitive and ill-considered. Daniel James, party chair, said there must be clear evidence of public support from islanders before any pilot programme with technology and apps is even considered. The island has a significant population of elderly and vulnerable people, and coronavirus is a fatal illness with no known cure. The priority must be the health of islanders living here now, not a focus on a Save Our Summer campaign to validate using the island as a boat hole for wealthy people fleeing the mainland. Councillor Dave Stewart said, "There is no suggestion that the island could come out of lockdown early. Any exit needs a well-managed approach with comprehensive monitoring and testing, with the ability to reintroduce control measures to ensure that our vulnerable residents are protected to the fullest." The island's unique status gives it an opportunity to better manage any exit from lockdown than most other areas. This is an opportunity which should not be missed and would provide the stringent safeguards the island's community and the Isle of Wight Council would support. During these unique and unprecedented times, the Council, working with partners in health and the voluntary sector, is working tirelessly to protect and support our island community. Your response has been amazing, but there's no time to relax. We must continue to take personal and collective responsibility to protect ourselves from the virus.
This is another article from OnTheWight, read by Terry. Wright School DT, that's Design Technology Department, have been making face shields for Isle of Wight healthcare workers. Members of the Design Technology Department of Wright School are in school during lockdown as part of the team looking after children of key workers during the coronavirus crisis. Whilst they are there, they're putting their skills and the 3D printers and other equipment to good use and making face masks for the local NHS and care homes. The first deliveries were to Tower House Surgery and Newport Residential Care Home. The headmaster and bursar have been in touch with other aid associations on the island to see what else will be of help at this time. Head of DT, Mr. J.B. Savage, said, "Whilst we are here in school for our key worker children, it makes sense to be able to put to good use the school equipment and resources to help as much as we can during this time and help protect key workers."
OnTheWight, read by Chris Kane. Neil more than halfway through 50 marathons before 50th birthday challenge. Islander Neil McColl set himself a pretty amazing challenge for 2020. Before he reaches the age of 50 in November, he is hoping to have run 50 marathons. That works out as one a week since the tail end of last year. Neil started his challenge with the Isle of Wight Marathon in October last year and is currently just over halfway through, having this week completed his 28th. Raising money for Mind. The challenge was taking Neil all over the country, but of course, since the coronavirus lockdown, he's been limited to running his marathon miles, 26 each time on the island. When he kicked off the challenge, Neil decided to raise money for Mind, the charity for better mental health, which he says, given these strange times, seems particularly apt. A Just Giving page has been set up and has currently raised just short of £1,000. Neil told OnTheWight, "Obviously now is harder going as all events have been cancelled, so I'm having to do my own solo marathons on the island. I'm even considering doing one dressed as Wonder Woman, if I thought it would get some donations in. If nothing else, it'll be good for social distancing. It would be great to boost that figure into the thousands by the end of his challenge in November." Neil has been keeping a blog of all the marathons that he's run so far. It's great to flick through them and read how he got on during each of them, plus to see all the inventive medals he's been receiving from friends and family for the lockdown marathons he's been running on the island this month. Well done, Neil, for getting over halfway through. We'll be keeping an eye on how you get on over the next few months.
This is Chris reading a letter to the editor of the County Press. I wasn't able to say final happy anniversary from Mr. R. Hall of Brading. My dear wife Frances passed away in the stroke unit of St. Mary's Hospital on March the 30th, our 56th wedding anniversary. I would like to thank the staff there for all their kindness and understanding. Also the staff in the bereavement unit, Kath and her manager, who kindly collected the anniversary card I had for Frances and made sure it was with her. Thanks also to the Isle of Wight carers, Kath and Sue, my neighbours Jules and Mark, Julia and Eddie and Joanna, who have been so kind with support and excellent dinners. I could not visit Frances in her final few weeks due to the coronavirus, so a big thank you to all.
This is Brian reading a letter to the Isle of Wight County Press. Does Boris really deserve this? From Molly Attrell, Knighton. I read with incredulity your report that Darren Street was crowdfunding to raise £1,000 to buy cufflinks for Boris Johnson as a thank you to him, and that 79 people responded with donations. That was from the County Press on the 17th of April. Thank you for what, may I ask? While everyone is surely pleased the Prime Minister is now recovering from the virus, it is premature to hail him as a great leader or saviour of the country. It should not be forgotten it was his own early cavalier attitude to the looming crisis that left us with shamefully inadequate supplies of PPE and no real capacity for testing or contact tracing, which might have helped to contain the outbreak. No one disputes the government is faced with an unprecedented situation, but we cannot simply put on rose-tinted spectacles and suspend judgment. Johnson is a very wealthy man. He doesn't need to be given cufflinks, and there is no evidence at all he merits any national gesture of gratitude at this time.
This is Chris reading a letter to the editor of the County Press. Lake Heroes, from Mrs. Phyllis Carvola of Lake. During this difficult time, I would like to give a big thank you to Lake Stores. They have been wonderful, delivering groceries with the paper and are so kind. I am 85 and they really keep me going. I also thank my kind neighbours and Christian friends. There has been a great coming together. There's also a great NHS tribute from Cliff Bennett of Cranmore, saying congratulations to haulier George Jenkins on his wonderful accolade for the NHS. And you can find that on Facebook.
Hello, this is Debbie from Dress for Less, Site for Wight's dress agency. I'm so inspired by how people pull together and want to help when times become difficult. I wanted to share with you some of the wonderful things that the shop volunteers have been doing to help our NHS and key workers in the current unusual situation brought about by the coronavirus. Those with sewing skills have been making bags for hospital staff and key workers to put their uniforms in at the end of their shift. They are then able to take these home and to place the entire bag and contents directly into the washing machine. This eliminates handling and potentially cross-contaminating other clothes. These are being made from old pillowcases and duvets supplied by both those engaged in sewing and our other volunteers. Belinda has been coordinating the effort by collecting and delivering the finished items as well as distributing materials. Also, those who can crochet have been making mask adapters. This is a small piece of crochet with buttons sewn on. This is worn at the back of the head and enables the mask elastic to be tied around the buttons rather than going around the wearer's ears, which can become uncomfortable. For safety reasons, these need to be washable, so each person needs a few adapters so that they can be rotated. I know that the people receiving these items have been very grateful, and I have been fortunate to receive photos of the items being worn, which I've been able to share with the team. I cannot wait to get back to our wonderful shop and see all my ladies again. I hope that all of you are sorting your clothes to bring us for when we reopen. Thank you for listening to me and stay safe, everybody. See you soon. Bye-bye.
Hello, Ruth again. I just want to let you know about a new service that has been launched by the Macular Society. It is called Tech by Kinect, and it links you with a telephone volunteer who can help you with any tech issues you may have at the moment, whether it be getting your smart speaker to work, setting up a video call, or making the use of online shopping. You can contact the Macular Society on 0300 30 30 111, and they can put you in touch with a volunteer who can do one-to-one tech support. Once again, the number is 0300 30 30 111.
We now have an article by RNIB Kinect regarding latest UK guidance for eye care.
We are being asked to follow new rules under COVID-19, but that doesn't stop us looking after our eyes. And we have some very important information to tell you about if you receive regular treatment or have an eye emergency. I'm joined by Mike Burden. He's the president of the Royal College of Ophthalmologists. Mike, thank you very much for joining us.
Thank you very much for inviting me.
So tell us, first of all, Mike, about eye departments themselves. How are they responding to the COVID-19 situation?
The primary aim of the response by ophthalmology departments is being to balance the safety of patients, many of whom are elderly, who are at risk of contracting the coronavirus, balancing that risk to them with the risk of them sustaining significant visual loss over the next, hopefully, 3 or possibly a maximum of 6 months. So what we've done is we have significantly reduced our routine follow-up of chronic conditions and have focused our attention on those conditions that are likely to cause visual loss over that period. For example, the treatment of wet age-related macular degeneration, retinal detachments, and uncontrolled glaucoma.
Now, eye departments, I'm sure, like many places, Mike, are having to look at keeping staff and people safe. It being the close proximity that's sometimes required for eye exams and so on, how are staff dealing with that?
This is a key issue, and the first way to deal with it is to simply reduce the number of people attending. Within departments, for the people who are still attending, departments have organised social distancing, both by distance in terms of the gaps between chairs, but more importantly, the timing of appointments to minimise the time that patients have to wait in clinic. We're only seeing the patients when it's absolutely necessary to do so. When we're in contact with patients, we are using appropriate PPE equipment, that's personal protection equipment, that actually not only protects the clinician from the patient, but the patient from the clinician as advised by Public Health England. Obviously, there is regular cleaning. And also, in some cases, we're actually using off-site working to minimise the attendance at a major hospital.
So everything is being done to protect staff and patients. But I think that the message as well, Mike, is if you do have regular important appointments, to maintain those.
I think the key message is that your consultant teams will be reviewing your upcoming appointments and asking that fundamental question: is it safer for the patient to have that appointment postponed for a few months or to be seen? And if the feeling is that the patient can wait, then either hopefully telephone advice or a written advice will be sent to the patient to advise them what to do during that deferment. And if it's felt that the patient needs to be seen, then the consultant will make that decision and offer an appointment. Obviously, the patient can very reasonably say, I'd rather wait, but when we send appointments out, we do so only because we think it is important that they do attend.
Now, there are eye clinic liaison officers and so on who can provide help through RNIB and other charities. We will be giving some contact details a little bit later if you have any other questions on this. But I think another important one, Mike, is also people who perhaps receive regular treatments. I'm thinking about things like glaucoma, where people have to receive regular injections. They should still attend, and these processes will be in place to keep everyone safe.
So for regular injections, we are strongly urging patients who are receiving injections for age-related macular degeneration or conditions such as diabetic retinopathy that they should attend for those injections. because not doing so puts them at significant risk of losing vision quickly. And unfortunately, if that happens, it may not be recoverable in 4 to 6 months' time. We are modifying what we're doing during those injections. So quite often patients would have had quite a number of tests before a decision is made to have the injection. But it may be actually safer to simply assume that the patient needs injection, to have the injection, and to leave the department as quickly as possible with minimum human contact and delay. So the process by which injections are being delivered is being assessed in order to minimise patient risk.
Now, we know that a lot of routine operations, including eye operations, are being postponed. That includes things like cataract. Will that have an ongoing effect on people's sight?
Cataracts is an interesting problem because obviously it's our most commonly performed operation, and as we do somewhere around 400,000 a year in the UK, there will be a significant people not having their surgery. Fortunately, cataracts do not cause permanent visual loss, and equally fortunately, they are unlikely in most cases to progress significantly over a period of 4 to 6 months. So it is very reasonable to defer routine cataract surgery, but obviously the ophthalmology departments will be planning in the near future their strategy to catch up post-pandemic. Other conditions that can't wait are the ones we're focusing on, as I've listed: vitreoretinal surgery, macular degeneration injections, and trauma. Things that can't wait, we will still do. And I should mention also, in terms of what we need patients to do, is if you are on drops for any condition such as glaucoma, unless you've been told otherwise, it's very important you continue on those drops.
What about people who have an emergency or suddenly notice a change in their vision? Is there any specific guidance for them?
At the moment, eye departments are being asked to maintain their accident and emergency departments as the primary port of call for patients who have significant visual symptoms. We are encouraging departments to be consultant-led so the patients can be assessed quickly by people who know how to deliver the appropriate treatment. So my strong advice to patients is that if they have sustained significant change in their eyesight, or if they are getting significant pain or anything that they are really worried about, their first port of call should be to ring their local eye department. The College of Ophthalmologists and the College of Optometrists, in conjunction with the NHS, are looking to see whether we can also provide advice for patients through the optometrists on the high street, and hopefully establish a network where optometrists can help to provide as I said, advice to patients as to who needs to go to the hospital to be seen.
Okay, so through your kind of local optician. Just a quick one as well, just going back to things like injections or medications and things like that, what's the supply chain like if people do need to take regular medication? Should they be concerned, or is there no problem with that at the moment?
My understanding is that there is no problem. It's difficult to say that's true across the country, but I've not heard of any need, and really you should not be hoarding medications or asking for a significant increase in the number of bottles of drops you get. And there is no evidence that I've heard of a problem with supply of the medications at the moment.
That's great. And just a quick note for people, if you do have any other questions on your eye health, this current situation, please do call the RNIB helpline on 0303 123 9999. That's 0303 123 9999. And we would, of course, like to thank all our ophthalmology staff for continuing to do their very best for patients during these difficult times. For the moment, to Mike Burden, thank you for speaking with us on RNIB Connect Radio.
Thanks very much.
How to Paint a Wall, read by Lisa. While I went out to work one day, she decided to paint the wall. And when I came home that night, she was curled up into a ball. Her eyes were closed, she was breathing hard, her hair was very wet. From her head to the tips of her pretty toes, she was covered all in sweat. She was wrapped in a jacket made of down with a fur coat right on top. The wall was glowing with new fresh paint. On the floor the paint can sat. "Sweetheart," I cried with a worried look, "are you all right, my dear?" She lazily opened her lovely eyes and smiled from ear to ear. "I knew I could do it," she said with a grin. "I followed the paint can notes. It clearly said for best results, be sure to put on 2 coats.
Sight for Wight would like to thank you for listening to this week's edition of the Talking News. We would also like to thank our volunteers for reading, and a particular thank you to the Isle of Wight County Press and OnTheWight. A special thank you must go to Vectis Radio, who has helped us get vital information to our members. Stay safe.